Welcome. We're going to do chapter 15, personal care. Now, this is a routine scheduled care and it is divided between early morning, afternoon, and bedtime. Um, you should know this. A lot of you guys are CNAs and know it, but this is really getting back to the basics because some people say they don't have time to do all this, like the back massage or the shaving, that kind of stuff, but we got to make time, okay? Back 15 years ago, bedtime, everybody got a little bit of a back massage to relax them. It's going back to the basics, guys. Another thing I wanted to bring up that you are not above personal care. No nurse is above personal care. I don't care if you're a CNA, LPN, ADN, MSN, BSN, DNP. You, that's part of the job is care for your patient, personal care for that patient. Yeah, we get to do all kinds of other things, but we have to make sure that this is done. Okay, hygiene, activities of daily living, bathing, washing and styling hair, brushing, flossing teeth. Brushing teeth, yes, very important. Think about it. If you don't brush your teeth, your mouth is going to be full of bacteria. Bacteria, basically, it can repopulate every 5 hours. So that means the bacteria is making procreating when you don't brush your teeth. So nothing pisses me off more than going into a hospital room and the cellophane still being on the toothbrush. We should make sure our patients are brushing their teeth. What happens if you don't? Well, the bacteria starts to grow. Then guess what? Your mouth is full of bacteria. It has nowhere else to go, but it goes down into your esophagus and windpipe and your larynx, right? If it goes down your esophagus, it goes into your stomach and it gets killed by the acid. If you don't brush your teeth and it goes down your larynx and then goes into your lungs, guess what you'll end up having? Yep, pneumonia. So that's why it's really important that we the patients brush their teeth. Because if they are immune compromised and they're in the hospital and they're not doing anything, that bacteria is just marching right on down their throat. And they could end up with pneumonia. Now, if they do end up with pneumonia, that is a part that Medicare and Medicaid will not pay. It's because it's our fault they got pneumonia. It's called hospital acquired pneumonia. So get out there and make sure that your residents and your patients are brushing their teeth. We are going to help with dressing and we're going to help with shaving. And here's the benefits of bathing the patients. I personally like bathing a patient because I can see all their skin. Nothing should be hidden whenever you're bathing a patient, right? And that's the best opportunity we have to see if there's any pressure ulcers or if there's any um, skin alterations. So I like I'm not as fast as my CNAs are doing baths because I go in between each toe. You know, that's another story. But what else does it help? Well, opportunity for skin assessment, increased circulation, increased sensation, comfort and relaxation. If you notice, a lot of your patients once they get their bath, they go right to sleep. Helps self-esteem. Did you ever go several days without your hair being washed? Especially if it's long. When it's short, it's a pain in the butt too. It looks awful. But when it's long hair, and you don't wash it, you know, maybe 3 times a week, it gets nasty. So that with nastiness brings down the self-esteem, and also establishes a nurse-patient relationship. I mean, how can you not have a relationship after you bathe the patient? So bathing is not just for smelly purposes. There's other purposes for bathing. Okay, patient preference and abilities. Preference when they get a bath. So if you have a patient and you offer a bath and they say no, I don't want a bath. Well, then you don't just say, okay, fine, woohoo, I don't have to give that patient a bath. No, you turn around and you ask them, is there a better time for you to come and get that bath done? Okay, you just don't, chalk one up. That's one bath you don't have to do. It is important for the patients to get bathed. Okay, culture. Well, some people might not want the opposite sex um, to bathe them. So maybe it's an Amish woman, maybe it's a little grandma that just doesn't like men, or maybe it is a man that doesn't want a woman bathing him, or another man. You know, we can't we can't negate their culture or their preferences. Abilities, well, some there are some people that would love to have a total bed bath, but if they're able to wash their face, give them a washcloth and wash their face and their hands. Okay, give them the opportunity to get as far as they can get, and then we can get the rest. Okay. Assistants encourage patients to do as much as possible. Okay, it's good for a patient to wash their own face. It makes them feel better. It makes them have confidence. So let's do it. Okay. One thing you don't want to do is overestimate the patient's ability. So you go into the room, maybe the lady's a little confused, and you drop off water, hot water, rags, and everything else. You come back and you just assume that they washed because the rags are in the water, and you dump it out. Come on, we got to do better than that. Okay, so maybe she can't help. Maybe there's places that she can't get. Maybe there's crevices she can't get, or he. So let's not overestimate what the power of the patient. Types of baths: we have complete bed bath, we have assisted or health bath. Assisted or health bath is due if a patient has some, um, well, if they're sick, if they're unable to breathe, or they get winded, well, that's the same thing as breathe, or, maybe they're dizzy, or maybe they have such a headache that they just can't do it. That's when we assist them with a bath, okay? We don't assist with a bath if a patient is a walkie-talkie. They can do their own bath. We don't have time for that kind of stuff, okay? A partial bath is one that we just generally hit certain parts of the body. Um, Maybe it's because the patient's on the toilet, so you can hit certain areas. Or maybe it's because that you were just incontinent, so you hit certain areas now, and then you're going to hit the other areas later. Generally, a partial bath includes washing the face, hands, axilla, buttocks, and peri area. Okay, the parts that patient would cause odor if not washed. Back in the day, they called it. I probably shouldn't say it on this, but let's just say it would be what would we call it? I'm trying to be politically correct. We would call it um, a sex technician bath, if you get my drift. Okay, so that's what we would call it back in the day, and we probably still call it today. So sex technician bath. I think it has a nice ring to it. Okay, anyway, tub bath. Not many people get tub baths, okay? But we do tub baths for patients that dangerous slips and falls may exist. Maybe um, other places that get tub baths are patients. I know burn patients sometimes will get tub baths, um, but it's really very far in between. I believe I see more tub baths in the long-term care than anything. But the invention of the shower chair has really taken it to another level. Because we don't have to do those tub baths. We can put them in a chair and shower them in the chair. They do have some nice elderly tubs out there, though, that are new design and have jets, streams, and everything like that. Wouldn't mind having one of those at home. For some reason, it's not allowing me to go to the next screen, which is very. It's broke. Why won't you let me go? A little bit of a technical difficulty on that one. Okay, we have showers, which we see a lot of times on long-term care. We do a lot of showers. We have wonderful showers at Good Sam, and we don't have many people taking showers, especially on our unit on 3200. I mean, I think I'd give a shower when we had open hearts. Patients would have to have a shower the evening or the afternoon before the procedure, the evening before the procedure, and then in the morning before the procedure. So we would use the showers then. Uh, since then, it's few and far between patients that get to have showers, and even then, they were so far few and far between that, gosh, every time I help someone with a shower, I end up with wet feet because I forget how to use the damn showers. Oh, I should have said that word. Okay, therapeutic baths. Bathtub is used for a specific reason. I did say burns before, so we can get rid of infected or necrotic tissue from wounds. Okay. Um, we also can consider therapeutic bath. Patients that are in labor and want to go into the world, into a pool, to help with their pain of childbirth. Okay, so this type of blanket bath, this is a type of bath that is done with the patient in a bed. It may be commercially prepared, or we can create it from the nursing staff. It includes a bath blanket, washcloth, and towels in a big, large bag. The linens are saturated with no rinse skin cleanser. The entire bag is then heated in the microwave and taken to the bedside. The patient is covered with a regular bath blanket, which is replaced with a heated, moistened bath blanket from the feet up. The patient is then massaged through the warm blanket. The heat washcloths are used for the face, and the heated towels are to cleanse the back, buttocks, and perineum. I don't know anybody that does that. Now, the bag bath that we used to do, which is the next one, you'd put like 6 or 7 washcloths in a bag, put the non-rinse skin cleanser in there, and then you would heat it up. We would heat up as many bags as we had in the unit and put it into a cooler to keep it nice and warm. I personally liked it. I like doing it that way. The cleanser smelled good. The patients really appreciated it. It was nice and warm, and then you would have some suds in there also, and it just, I don't know, just the patient really enjoyed it. And I tell you what, 9 out of 10 times when I was done with the using a bag bath, they were sleeping. But for whatever reason, we got rid of it. Don't know why. Kind of liked it, but like at SSM right now, um, we're doing the commercially made bags. Don't know why. Does not like me. Nursery responsibilities during bathing. Assess for any abnormalities on the skin and report them to the nurse. And if you're the nurse and you see it, then what we're going to do is document it. Okay. We have to make sure that we're looking at the bottom of the heels. We're looking at the sacrum, um, elbows, wherever there's bony prominences. We're also looking for breaks in integrity. Maybe they scratch something. Maybe they have a skin tear. So the bath is the best thing when it comes to looking at your patient's skin. We need to complete it in a timely manner. We don't want them to get cold. We want them to get nice and cleaned up and then warmed again. Okay, be alert to signs of patient fatigue. Whenever you talk about somebody that can't breathe, they're using every calorie they have in their body to breathe. So they're easily winded, they're easily tired. Let's do as much as we can until that patient is showing fatigue. And we also want to help to conserve the patient's energy. I've had patients in the past that if they wash their face, they desat. We've had patients that whenever the nurse and the CNA were given a bath, the SATs went down into the 70s. Okay, we have to be cognizant of what's going on with that patient. So we just can't look at bathing as a task that we have to get done. It's a task that is a tool for us to help in our patients. Okay. Okay, aspects of ADLs, back massage, gone away from the basics. Um, Back in the day, part of PM care, before patients went to bed, where they got a little bit of a back massage, put them right to sleep. Probably if we would have done that, we do that now, probably give out less Xanax and Ativan and sleeping medications. So if a patient's unable to sleep, don't call a doc for an order for a Xanax or Ativan, or I'm trying to think some of the other ones that people use to go to sleep with. Um, do a back massage and see if that works. Oral care, conscious patient, let's get it done. Get that cellophane off, get that toothpaste on that toothbrush, and get them going. Unconscious patient, they could have leukoplakia. Uh, Leukoplakia is these white patches in the mouth. A lot of times it's thought of that smokers and people that chew tobacco are more at risk for leukoplakia. It's non-cancerous, but we've had in the past found cancer cells in the leukoplakia. Some people consider that a precursor to oral cancer. So let's not let that leukoplakia happen. Let's get the teeth brushed and kill all that bacteria in there. Denture care, very important to take care of dentures. Please don't drop them. My first clinical, one of our first clinical as a student, one of my fellow students broke dentures, dropped them and broke them in half the first day of clinicals. Not a good way to start clinicals off. So please be careful with them. It's very important that we not only clean their dentures, but we make sure we don't lose them either. Okay, shaving. Some guys shave every day. Some guys shave every other day. Some women shave. You know, so helps the patient feel better. So let's not forget about the shaving. Nail care. We do not have nail care, nail clippers in the hospital, mainly because we have a lot of diabetic patients and we don't want to cut their fingernails and cause an injury. So a lot of times, even especially with the hospital, we'll have to call a podiatrist to come and deal with some nails. Um, Caring for piercings. Some people take their piercings out. Um, some people leave them in for however long. So let's just ask the patient what they exactly expect from us with the piercings. It's not letting me hear beeping at me. Rude. Let's talk about hair care. Um, when we're doing hair care, we're going to make sure we look for lesions. Tinea capitis. What it is basically a fungal infection of the scalp. It's basically the fungus goes into the follicle, the hair follicle, into the root, and you end up with dry patches. Okay. Um, it's also the same, what do I want to say, the same bacteria that, or um, fungus that goes into, same fungus that goes into ringworm. That's what it is, ringworm. Um, Usually you see ringworm on patients, bodies, but it can also be up in the scalp also. Seborrhea, that's another word for eczema. Eczema. It's on the head though. It's eczema on the head. So things that we would use for tinea capitis would be antifungal. So you're talking about like diflucans, things like that. Medicated um, hair products would help with the seborrhea. It could be antifungal, it could be antibiotic, it could be anti-itch medication. We also look for lice and nits. I tell you what, I worked on the units whenever we had COVID, and we would, of course, gown up all the way up, but you never see people put as much um, PPE on as if the patient has lice or nits or bed bugs. That's when we really care. COVID, when it first came out, yeah, we were really careful, but we are always careful with lice and bed bugs. Eye and ear care, contact lenses, people leave them on for months now. Um, I couldn't do that. I had to take mine out every night, or my eyes I would be bloodshot red. Artificial eyes. Some people do clean their own eyes, artificial eyes. I always wondered though, if you pop down an artificial eye, would it sound like this? We had a neighbor that had an artificial eye. My dad would take him to get his eye cleaned, and I asked him. My dad just shook his head. So I don't know. Does anybody know? Anyway, hearing aids also. Let's not lose any of these things. Contact lenses, artificial eyes, or hearing aids. They're all very expensive. Hearing aids are coming down in price a little bit now that uh, it's a law in Illinois that hearing aids are covered by insurance a little bit. I say a little bit. So let's not lose them. And if they need any help, let's ask the patient how they want you to help them. Okay, managing the environment, the patient room, provide privacy if a roommate is present as much as you possibly can. Usually the furniture is a hospital bed over the bed table, bedside stand, and a bedside table. It's important that we declutter. We're going to be paying attention to managing the environment. Noises. We want our patients to sleep. A lot of times patients complain about noise in the hallway. Remember, if you're in a nurse's station, does not mean that it is soundproof. I know on our unit 3200, there's certain rooms that seem like they amplify what's going on in the nursing station. So be cognizant of what you're saying. The patients don't really care if you got drunk last night or anything like that, okay? Or that so and so was cheating on so and so. They don't need to know that. So please remember your voice carries. Odors. Um, Sometimes we can't help the odors. We can put some machines on the outside of patients' rooms that help with the odors. I don't think they really work. I think that they just sold it to the hospital and they are making tons of money on us. But if somebody had a bowel movement in a bedside commode, pitch it. Get rid of the poo. Okay? Clutter. I can't stand clutter. Taking those dirty trays away. Putting, everybody likes to hoard the jellies because they don't want to pay for jelly, so it's all over their bedside table. There's places we can put that. Don't bring in a bunch of linens and leave it on the table. Put them away. We have drawers. Throw your clutter away. Okay, throw trash away. And that's all I'm going to say about that subject. Equipment, make sure the equipment is plugged in if it needs to be plugged in. If not, and your patient doesn't need it, get it out of the room. Other patients might need it, and it's better to be put into the storage rooms. Bed making, we have unoccupied, we have open bed. Basically, it's folded, um, folded to the foot of the bed. It just makes it look welcoming for the patient when they come in. The surgical bed is folded to the side so that it's easy for us to slide the patient into the bed and then cover them up. And a closed bed is totally covered. It's a covered bed. And then, of course, an occupied bed the patient remains in bed. Okay? Nothing much to say about that subject. Um, what is the responsibilities for bed making? CNA or UAP can make a bed. A nurse can make a bed. ADN, LPN, MSN, DNP, they can all make beds. We try to do it without wrinkles because that could injure the skin of a patient. We do have a draw sheet or a turn sheet. Anymore though, we use pads to use as our turn sheet and our lift sheet. And then we have the mitered corners. Okay. If a bed keeps on coming undone, We just tuck it under there. The miter corners will stop that from happening. Okay, and here's some common bed positions. We have um, the flat bed. Not really surprising, huh? Fowler's bed is when the knees are slightly elevated and the head's up, and the knees is basically elevated to stop the patient from falling down, even though they still fall down. Semi-Fowlers, we generally use Fowlers when somebody is continuous tube feed. We don't want them to aspirate. And patients usually are in semi-Fowlers when they're watching TV or talking to family. Some people rather be Fowlers with the knees up a little bit, but it's what the patient would like. Trendelenburg, it's used when patients have low blood pressure, or we just want to make sure that there's enough blood going to the brain. Okay, so we're going to put them basically on their head when we're talking about semi-Fowlers. And research shows that it doesn't work, but as of right now, we're still going to say that we use it until the books change. NCLEX is going to say the same, and they're going to say that is for low blood pressure. Trendelenburg. Reverse Trendelenburg is when the feet's down and the head is up. We generally use this for patients that have to lie flat for whatever reason. They kind of feel like they're, able to look up and watch TV and talk to their family. On here it says that we put reverse Trendelenburg for catheterizations. Generally, catheterization cath, when we're talking about heart cath, they come back to us flat. We put them in a reverse Trendelenburg just so that they can eat and talk to family. It's not necessarily what is ordered. I mean, we just have to leave them flat. That's generally the order. Clicker question. Which of the following describes a partial bath? Bath is completed using a basin of water at the bedside. The patient participates as much as he or she is able, and only selected areas of the patient are bathed, and patient sits in a tub of water. What do you think? Partial bath. And ding, ding, ding. The answer is C. Only selected areas of patients are bathed. I told you what I felt those were called. That kind of bath. It's not politically correct, I'm sure. But okay, next. During a bed bath, you will wash from distal to proximal to improve blood return from the extremities back to the heart. This is referred to as, well, if you're talking about going back to the heart, then we're talking about the veins, and the only thing around here that looks like veins is venous return. And here we go, venous return. Okay, that's everything I have with personal care. I hope you weren't too bored. Now on to moving and positioning patients. Woohoo!